Professor Rowland, before we get into the topic of the interview, I want to explore a little bit about you and your work. You're a mathematical biologist. Can you explain how maths and biology interact?
Well, in my case, what you're looking at is how elements of systems interact. So you've got individuals who do things like, in this case, transmit disease. And what we want to understand is how the processes of those people or animals interacting leads to disease and disease progression. And we can describe the contact patterns between individuals in terms of mathematical equations. Those equations can be modified by things like the environment that surrounds the individuals, different types of individuals, how long a disease lasts, and all sorts of other factors. And that combination of understanding biology integrated into those equations helps us understand what diseases will persist and what will emerge.
You study the spread and persistence of livestock diseases such as foot and mouth, bovine TB, scrapie, avian flu. What have you learnt about these diseases and how they spread?
I think one of the most important lessons you learn is just how important heterogeneity in populations matters. And by that I mean how individuals differ, both in terms of their disease presentation, for example, in terms of whether or not they get infected in the first place, but for me, most importantly, how the patterns of contact influence whether disease spreads, how it spreads, and who's responsible for spreading it.
Zoonotics, is it a relatively new area of research? And is it a growing problem, the number of diseases that are spreading from animals into humans?
It's definitely becoming more prevalent. People have always been aware that diseases transmit between populations. And in fact, I think the first record we have of a zoonosis is in the Iliad. So talking over 1,000 years before the birth of Christ, where they talk about what people think is glanders, so a disease of horses then infecting people. What's relatively new is this study within quantitative epidemiology. Now, part of the reason for that is because a lot of the diseases that we're interested in, that we're worried about, are single host diseases, and they're the ones where we have the most success. But in fact, a lot of the diseases, the difficult ones to handle, are one where another host, another species, other than say ourselves, are infected. For obvious reasons, that while we have very good knowledge of what people are doing, we may, for example, have very little knowledge about wildlife are doing and how the disease persists in them.
COVID-19 is obviously the big disease at the moment, and you've been working with Public Health Scotland on some modelling. What has this involved and what have you learnt about the disease?
Well, the first thing we learned was how much simpler it is to model COVID-19 than it is to model bovine TB. So we're largely modeling it as a single host pathogen, so a disease in the human population where we're not too worried about what other host populations are doing. So we've tried to understand how the disease is spreading across Scotland. So what are the regional differences? And part of the reason for that is that because, as we're finding out with regards to things like local lockdowns, is different places will have outbreaks at different times. So we've been studying, for example, the effect of things like patterns of movement to work or where the disease might go, but also things like whether or not what's called the index of deprivation has an influence not just on the patterns of mortality, but also on the patterns of who is getting infected.
And is the disease changing?
There doesn't appear to be evidence of that from the data that we have. I know there's some studies that suggest these things are happening, but science is an ongoing process and it's always developing and always changing. Certainly from the data we're looking at, it does appear that while some of the patterns are changing, so for example, care homes are relatively less involved than they were at the beginning of the pandemic. Broadly speaking, the same factors, the same risk factors we saw at the beginning appear to be there now. We know more about what's going on, of course, and that is changing things.
Turning to the topic of One Health approaches to emergent diseases, I'm asking every guest this, but what is your understanding of One Health?
Well, it's going to be true that any major disease problem that we have is going to have multiple interacting factors. Okay, so it's never going to be just one thing. What makes a One Health problem different is that having the perspective of understanding how the disease is transmitting in more than one species, in humans, in wildlife, in livestock, helps you to understand how better to control it. And to me, that's actually one of the key things. It's not just that the disease involves more than one species. It's not just that it transmits from wildlife to livestock or to people. It's the fact that our understanding of it and our management of it, if it needs to take those things into account, that becomes a One Health problem. And I think that's really important to remember.
So has science in the past suffered from a silo mentality?
I think siloing is one of those natural things that occurs no matter what. I mean, we always talk about interdisciplinary research. And the thing is, the way I would look at it is, once interdisciplinary research becomes successful, what happens is it creates new disciplines, right? You define things. So One Health may become a discipline. Inevitably, that may create different boundaries in different silos. So that whole process of siloing, developing interdisciplinarity, I think is an ongoing and continuous one. It's not a process we can ever think of as being complete.
Emerging disciplines such as climate change and other environmental factors, maybe it's the wrong thing to say that they're emerging, they've been around for a long time, but it feels like they're emerging branches of science to the layman. What impact are they having on the number and severity of diseases?
So it's an interesting question. We don't actually know whether or not the number of diseases themselves are necessarily changing. Simply their patterns are changing. That much we can be certain of. Now, the reason why I say that is because the number of viruses out there is orders of magnitude than the number of the ones that we actually care about. Whether we care about them depends on whether or not they affect species that we care about. Yeah? So in many ways, you consider what's changing is the interactions between the populations. How much are we exposed to wildlife? How much are our livestock? How much do we have to worry about? For example, the increasing levels of antimicrobial resistance, which everybody is aware of, changes the diseases which we think are important.
Reading some of your research, I was shocked, and it really felt counterintuitive that some of the responses to climate change and loss of biodiversity will actually risk increasing the severity of diseases and the spread of diseases?
It is interesting. I mean, we're doing these things for a reason, yeah? So what we're doing is we're trying to respond to climate change by changing the way we do things. We're trying to increase the amount of wildlife, and they're both very, very important things. Wildlife may hold certain diseases. They may have always been out there, but by increasing the amount of contact between wildlife and livestock, or between wildlife and humans, it increases that opportunity for the disease to transmit. And the other factor, which we tend not to think about so much, is the effect of disruption. Yeah. So things can reach a stable state where you sort of know what's happening, you know what's going to happen next, but as soon as you disrupt it, as soon as you change the patterns of what is going on, that changing of the pattern provides opportunities for new diseases, which again may have always been there, or shall we say old diseases, new opportunities to move from one population to another. All that is about the kinds of changes which we're implementing in response to climate change and in response to things like trying to promote greater wildlife diversity.
Are policymakers sufficiently aware of this, or is it too much of a hot potato for them to say we have to balance biodiversity loss with the risk of diseases emerging?
So that is an interesting question. I would say that at the very least, at the civil service level, they would be aware of it. So one of the things I do is I sit on DEFRA's Science Advisory Council, and these are the kinds of questions, as they formulate their plans going forward, the future of farming, the 25-year plan, and other things, awareness of how these changes could potentially interact and how they could affect things. Whether that gets down to the point of politicians and policy, you're going to have to ask somebody else.
Livestock diseases such as foot and mouth, bovine TB, scrapie BSE, avian flu, are they more likely to recur and re-emerge now?
So they will change. So things that we perhaps were worried about before will become less of an issue. New things will become an issue. So beyond the diversity and the climate change issues, there's also the ongoing concerns about animal welfare, animal health, and sustainability. So the expectation, I think everybody expects this, is that whatever else happens, we will probably have fewer livestock who are kept better, certainly in this country. That's our expectation and our hope, and that is absolutely the direction we should go. Now, that will have an effect on decreasing the density of those livestock, so the number of animals you keep per hectare or per acre, and that alone will reduce transmission within the livestock communities. So certain diseases, which might be oriented, say, purely around cattle, for example, you might expect to go down. On the other hand, those diseases where the wildlife interact with the livestock, Think, for example, of, well, bovine TB is one that a lot of the people who'd be listening would be aware of. It's currently transmitted amongst badgers and cattle. Those are the main species of interest over here. But we know, for example, it could also transmit in deer. Yeah. Now, the number of deer is going up quite dramatically, in fact, as are badgers. So there certainly is the possibility that rather than just having badgers as being a potential reservoir for the disease, that deer could be a reservoir for cattle as well. And that's what we see in other countries, like in the United States and also in Germany.
Does climate change in itself increase the likelihood of new diseases spreading? And if so, why?
Again, it's probably more about changing the profile of diseases. So one of the things we know is that diseases that are transmitted by vectors, so for example, by vectors I mean by some kind of other secondary host who moves the disease from animal to animal, from animal to people. An example that many of the people listening would be aware of is malaria. So malaria transmits in humans, but it's transmitted by mosquitoes. In livestock, we would have something like blue tongue virus, which is transmitted by midges, or African swine fever, which is transmitted by a particular group of ticks. Now, anything that is transmitted by an insect is more susceptible to climate changes because insects, as we know, here coming to the end of mid-season in Scotland, they have a very seasonal pattern. So whether or not the disease persists over here depends to some extent on whether or not those vectors, those insect or arthropod species, can survive long enough to cause that transmission. We know, for example, that blue tongue virus does not overwinter well in places like Scotland. Possibly it could in the south of England, but even there is slightly problematic. But as the winters get warmer, we would expect under climate change, the midge species which carry the disease start to become more prevalent and can last longer. And that lasting longer allows the disease to overwinter. So climate change there can have a huge effect.
Another area of great concern, antimicrobial resistance. What are the factors driving that increase?
So evolution of the pathogens, the bacteria in particular, which we used antimicrobials to control, they respond to what are called selection pressures. So basically, if you create circumstances in which the bacteria doesn't persist, there will be a small number who will develop mutations that allow it to persist better. And if that happens, then those ones that persist under that selection are more likely to reproduce. Eventually, by continuous use of antimicrobials, and some of those bacteria surviving over every generation, the bacteria reach the point where they actually are effectively completely resistant to antimicrobials. And we've seen that happen over and over again. And what we've been engaging on for the past several decades is sort of a war of escalation where we find new antimicrobials, the diseases respond by becoming more resistant, and then we find a new one again and again. And where we are now is we're reaching the point where we've run out of essentially the antimicrobials that we can possibly come up with. At that point, we'll have to find other means by which to control diseases.
So how do we tackle these issues in a One Health way?
So I think one of the biggest things that we need to think about is just how much the way we control diseases is based on effectively tradition, on long established approaches to dealing with things. So if you think about it, the way we control, much as the way they say we're always fighting the last war, we're always controlling the next disease outbreak the way we controlled the last disease outbreak. Now, my view, and again, this is just a view, there's lots of reasons why this is difficult, is that we have to change that. Okay? So with climate change, with our attempts to control the changes, reductions in biodiversity, with all sorts of things about the way we do things and who in fact is doing them, the nature of the disease that we face will be changing at a much more rapid pace than we had before. And that rapid pace means that reliance on tradition, on traditional ways of doing things, has to go down. We have to be much more nimble about it, much more aware of how the underlying data itself about how diseases are transmitting as changes, and be adaptable. What that'll probably mean is that our responses to things will have to be much more driven by the circumstances as we see them. Now, how we go about enacting that is a huge challenge, and I really can't say I know, but I think it's a challenge we have to face up to.
Changing policy is one thing, changing behaviours is another, and you've carried out research into the risks of livestock movements and why farmers do it. What's that revealed in terms of management of disease?
So one of the things it reveals is something that every time we look at human behavior in every setting comes up, which is that people are extremely varied in how they respond to things. Some people do the same thing all the time with almost clockwork regularity. Some people trade their animals in exactly the same way from year to year. Other individuals do something completely different all the time. So the key point here is that if we're looking for typical human behavior, the typical thing is that everybody behaves differently. Now, despite that, there are obviously some principles that we can apply to how people respond to events. And in particular, one of the areas I'm interested in is how the actions of one individual influence the actions of those around them. And it all comes under the general area of what's called as game theory. So game theory is all about how the actions of individuals influences the actions that you might take under a given circumstance.
In a perverse way, has COVID-19 actually helped in terms of changing public attitudes towards disease?
So that's a really interesting question. And I think we need to leave the long-term answers for the long term. It's very difficult to predict how events change things over that time frame. But certainly what we see in the short term is obviously a greater awareness, first of all, of the importance of science. So this is one thing that's really come up is there's an appetite for people to see what the science is telling them. And partially going back to the question that you asked before, because we have no reference point for understanding this disease. So we might think about seasonal flu in regards to our own past experience of it. Because there's no past experience of COVID-19, the only place to go for answers is the science. So that certainly is one instance. The attitudes towards social distance, okay, so people interacting with each other, the sort of demonstrations of physical contact as a way of greeting, so shaking hands, hugging, etc., they've completely disappeared. Now, whether or not that is going to result in a long-term awareness of how diseases transmit and how these things affect them, again, only time will tell.
Finally, it's timely that the World One Health Congress is taking place in Edinburgh, even in a virtual sense. What are you hoping are the messages that people take away from the Congress?
Well, if we go back to the COVID-19 example, this is a disease which emerged, probably came from wildlife, transmitted through our interactions with those wildlife. I think that awareness that the world of disease is a complex place. The idea that we have these diseases around us, we need to be aware of them. And I think the key thing to keep in mind is infectious diseases in countries like Britain, the US, Canada, that countries which had largely gotten rid of infectious disease as a problem for human populations, now need to be much more aware of them. So, cancer, stroke, other chronic type ailments, shall we say, they were very much the focus of our population. And what COVID-19, I think, has done is raise the awareness of just how deadly infectious diseases can be, thinking again about as antimicrobial resistance becomes a problem, bacterial diseases will also become more important. But that highlighting of infectious diseases, that they can have such an impact on us, and the fact that they arise from things like how we interact with the natural world. And so understanding that natural world, understanding how that world creates, promotes, and allows diseases to persist is really crucial. And I think that's a big part of what One Health is about.
Professor Rowland, thank you very much for your time.
Thank you.